Hi, I'm Jonathan Iman. I am your professor here in PSE 5461, Psychopharmacology for Therapists, and it's an online presentation. I'm looking forward to working with you to deepen your understanding of how uh, pharmaceuticals fit into the practice of a non-prescribing licensed marriage and family therapist or licensed professional counselor. Um, I am a graduate of Antioch end of 2003. I've been licensed as an MFT for the last nearly 9 years. I've taught, I think, 8 different courses for Antioch over the last number of years. And I spent 13 years in the adult outpatient mental health clinic for County of Santa Barbara, dealing with adults who have persistent severe mental illness. After that, I spent a year running their field-based crisis services, and now I am working closer to my home down in Ventura County for Ventura County Behavioral Wellness. I run a substance abuse and co-occurring disorders clinic focusing on women with children, trying to help them break the cycle of addiction and um, diminish its impacts on their families. So I hope that you will let me know a little bit about you as you communicate with me online. Let me know your background a little bit. Where did you get your BA? Are you working towards becoming an MFT or an LPCC? How far along are you in that process? I'd also love to find out if you are concurrently taking the core psychopharmacology course or if you have already completed that. My assumption is that one or the other is the case, excuse me, and that you will be already familiar with the majority of the content of that textbook, which is shared between both courses. So this is a class where we're going to try to go into more depth, help you become somewhat expert in a certain area, at least one area of psychopharmacology, and then share that expertise with your peers. In addition, I hope you will learn how to find out what you want to know about psychoactive medications and substances in the future. So let me move on a little bit here. This should be about a 15-minute YouTube video. I apologize for my rustiness in the technology. I usually teach live courses. It's been several years since my last online class. So I literally had to dust off some of my equipment, but bear with me. And my intent is that you won't have an endless supply of talking head shots, but for now, I just need to get up and running. So let's proceed a little bit here. I've already asked who you are, told you a little bit about who I am, and I need to ask you and get from you an understanding of what area of medications you personally would like to try to focus your attention on. As outlined in the online material, I have 5 or 6 groups of medications that I've set up, and I want to get several of you to work together, or at least work in coordination to prepare a brief presentation at the end of the class period, not this class period, but at the end of the course, so that your peers can benefit from your research and your analysis of how antidepressants or mood stabilizers, for example, maybe antipsychotics fit into the overall treatment approach of helping people suffering from some of the psychological problems that we are going to be facing in our careers. So let's see. Your current reading assignment should be posted online, and I actually want you to read chapter 22 and chapter 23 and look at, I believe it's Appendix B. It should be written down and offset my sometimes scattered memory, but typically you will not be reading meticulously large sections of the text, but I may be asking you to scan or skim over a number of chapters that I've am expecting you to have already studied for the other course. Um, but this time I want you to look at the 6 reasons in the textbook why a change in medication might be indicated. Those should become fairly fixed in your mind. Also, you will understand more about the psychopharmacology involved with treating younger people. Children and adolescents are not just smaller adults. The biochemistry, the developmental processes are quite different and necessitate a different approach. You'll also tend to see a different cluster of conditions in children. ADHD is a common one, depression, bipolar illness, occasional early onset psychotic conditions, anxiety disorders, um, and autism spectrum disorders are the most common things. So you want to be familiar with that. Of course, if you hope to be moving into working with children and adolescents, you will want to pay a lot more attention to that chapter and build up your familiarity with that. Of course, the question might come up, well, why do I even need to do this? Why do I need to take this class? Why should I pay much attention? I'm not allowed to prescribe medication. You may also be aware of the fact that it's a diplomatic process communicating with some physicians and prescribers because they're very aware that medication is outside of our scope of practice as therapists. And sometimes they take offense if we're not careful in how we present our thoughts and our observations, feeling like we're encroaching on their domain. So the precursor course to this one does spend some time working with you to figure out how to share your thoughts successfully with a physician. And remember, we're here for the client, not for our own egos. It's not a matter of getting a doctor to acknowledge the wisdom of what we have to share. The intent is to work collaboratively with another professional for the well-being of a human that we care about and help provide care for. So that can be challenging sometimes because over my many years in different professions, I've seen a lot of doctors are great people, very collaborative, very open to our input, but some you have to walk around delicately and know how to present your thoughts in a very tentative way, a very gentle fashion. Again, because we care about the client, not about our own opinion being validated or our own professional competence being acknowledged. So that's why you're here. Many of your clients will be on medication. Some will be on non-psychological, non-psychiatric medication that can have psychiatric impact. Some people have a vigorous psychotic response to the use of certain steroids, uh, even health conditions. I've been amazed at the florid psychosis manifested by some clients who have a urinary tract infection. And when that infection is cleared up, the psychosis disappears. Uh, Things like over or underactive thyroid can create symptoms that mimic depression or anxiety. So a lot of things of that sort. Uh, we are important because compared to a physician, even a psychiatrist, we have many more contacts with most clients, most patients. We spend more time with them. We listen to them more carefully. We have an opportunity to actually train them how to observe themselves, how to report on what they're observing in a objective and clear way. We have the opportunity to help motivate them to pay attention to how they're responding to medication and other parts of their treatment package, and somewhat standardize that reporting process. And the average physician may spend 5-10 minutes face to face with a patient, sometimes not even that much. And oftentimes does not have the opportunity to really build the rapport that we can with clients, and doesn't have the opportunity to really explain what to look for, what will it look like when you begin to improve, what symptoms may change or respond first, and should we look for complete um, elimination of those symptoms or simply an attenuation, a reduction of them, and some lessening of the impairments that the client is experiencing because of their mental health condition. So we have a really special opportunity and an important role of a pharmacist. Very little conversation with the client as to how they're doing, other than watching out for contraindications or medication conflicts or side effects. So that's why we have you here in this class, because you really are um, the tightest liaison between the client and the medication that they may be taking. And so when you learn how to help the client to understand what's going on, what to expect, report accurately what they are experiencing, and then you disseminate that information, excuse me, in a professional, effective way, it can really, really facilitate recovery for our clients, and that's what this is all about. Okay, um, let's see. I've got my little notes above you here. uh, I want you to really take advantage of the chance to listen to your clients. That should, of course, go without saying, but learn how to ask um, open-ended questions. Train clients who are taking psychiatric medications uh, about what to expect, what symptoms to pay attention to, how to measure those. Remember, most of us in our current culture, we have been trained passively to expect that some device is going to tell us whether we are well or not. You're going to get a blood test. You're going to get the blood pressure cuff will tell you if you have high blood pressure or not. Your glucose meter will evaluate your diabetes. A thermometer will tell you if you have an infection and a fever. All of these things, some sophisticated, an MRI will tell you if you have a torn ligament and so on. But in mental health, in psychological and emotional conditions, the client truly is the expert. They are the only one that actually knows what's going on inside of themselves. And we help them to put it into words that will communicate well with others. And then we can be the professional bridge helping other treatment providers to truly understand better what's happening with the client. And in the case of psychoactive medications, how is that patient, doctor, really responding to what you're doing? And we pass that information on. I had the privilege of working with some excellent psychiatrists for, like I said, more than a dozen years at the Kyrial Adult Outpatient Clinic. It was a great education for me and a great opportunity to provide excellent care uh, for the clients that we were treating. So let's see, you have some assignments posted online. Please pay close attention to them. It's a little bit of a complicated process doing a course online. I need you to interact with me and with one another by posting things on the course site, including some of your written assignments, which I've tried to make brief, but have you use them to stimulate some thinking. So thanks for joining the class. Feel free to email or call, and I'm looking forward to working with you. Take care.